Hi everyone and welcome back to my channel. I'm Sheila G, the PAC, and in this video we'll be discussing everything you need to know about isotretinoin, aka Accutane. In this video we will discuss everything as far as side effects, benefits, and how to actually initiate the process of Accutane, including how to navigate the Ipledge REMS program for patients and providers. This video is not only aimed at those interested in or even on Accutane already, but at students and healthcare providers who are confused about the Accutane process, as there's a lot to learn. So getting right in, what is Accutane? So the generic name for Accutane is actually Isotretinoin. Accutane is now a branded name for the medication. So from here on out, I'll be referring to the medication as Isotretinoin. Isotretinoin is primarily used to treat severe nodulocystic acne, as well as some other conditions affecting the pilosebaceous unit. It is an oral retinoid. For those with severe acne who have failed traditional treatments, isotretinoin may be indicated for those who are good candidates for the medication, and it is indicated only for those who are 12 years old or up. So how the medication actually works: isotretinoin, as previously mentioned, is a systemic retinoid, which means that it is a vitamin A derivative that works by shrinking the sebaceous gland and inhibiting its function and differentiation, which that means that it stops those sticky skin cells from clogging the pore. More specifically, it is thought that isotretinoin works on retinoic acid and retinoid X receptors within the cell that are important for gene expression and differentiation. Although isotretinoin does not directly kill bacteria that is involved in acne, known as Cutibacterium acnes, it actually may make the environment less hospitable for its growth. And it does that by creating an aerobic environment. So, the bacteria in acne thrives in an anaerobic environment where there is no oxygen present within those clogged pores. By opening up the pores, it will actually lead to an aerobic environment where bacteria can no longer thrive. Isotretinoin is the only medication that targets all four pathologic factors involved in acne. It may not only clear the acne that you have while on the medication, but it also may be curative of cystic acne in over 50% of patients who use the medication correctly. But we'll get into that when we talk about dosing. So the real question is, why is this medication so tightly regulated by the FDA, and what are its potential side effects? Well, because isotretinoin is a systemic retinoid, again a vitamin A derivative, it is extremely likely to cause severe birth defects in those who handle the medication while pregnant. It is category X, which means that it is considered teratogenic. Because of this, there are several obligations and steps in place to prevent those on the medication from getting pregnant, but we'll get into all of that shortly. Please be advised that this medication is not mutagenic, which means that once the medication is discontinued for at least 1 month, it does not have any impact on fertility and does not cause any future genetic alterations. Moving on to side effects of isotretinoin. Dry skin, dry lips, pretty universal. Because we're essentially shutting down oil production, you can expect the skin and mucous membranes to become quite dry. This may also slightly increase your risk of getting mild nosebleeds and worsening eczema as well. Other side effects that we may see include joint and muscle pain, headaches, nausea, blurry night vision, and constipation. The medication may also have a potential, yet not proven, association with ulcerative colitis and Crohn's disease. Another potential yet highly controversial association is with depression and anxiety. However, a lot of healthcare providers, including myself, can attest that this medication actually may improve depression and anxiety, because we know that acne itself may lead to a very negative self-image, so this medication may actually be helpful in that regard. But that's a whole other discussion for another time. While on isotretinoin, you may not donate blood for at least 1 month after discontinuing the medication, as it does stay in the system for about 30 days. Isotretinoin may also transiently increase cholesterol and triglycerides, as well as liver enzymes. And that is why those labs are tested at baseline and throughout the course of isotretinoin. Although the incidence of significantly increased lab values requiring either reduction or complete discontinuation of the medication is very low, especially among young, otherwise healthy patients. It's also important to note that these labs are fasting labs, so you cannot eat about 8 hours prior to getting the labs drawn, as it may alter the lipid levels. As far as contraindications to the medication, obviously pregnancy is number one. But in addition to this, tetracycline antibiotics such as doxycycline should not be used in combination, as it may increase the risk of what's known as pseudotumor cerebri, which is where pressure in the brain increases. But that's pretty rare. So how is isotretinoin dosed? For acne, isotretinoin is usually dosed at 0.5 to 1 milligram per kilogram of body weight per day, taken in 2 divided doses. This medication is best absorbed when taken with food. In most cases, we dose at 1 milligram per kilogram per day. So let's say we have a female patient that weighs 132 pounds. So we need to get her weight in kilograms. So to do that, we divide her weight in pounds by 2.2, and that will give us 60 kilograms. So isotretinoin is available in 10 milligram, 20 milligram, 30 milligram, and 40 milligram tablets. So for this patient, if we're dosing at 1 milligram per kilogram per day, she will need to receive 60 milligrams daily of the medication. But remember, we're dividing twice daily. So in her case, she will be prescribed a 30 milligram tablet that's supposed to be taken twice a day. Sometimes clinicians will actually make that first month of isotretinoin 0.5 milligrams per kilogram per day just to assess for tolerance and to limit purging, but that's not every case. But let's say we're doing that for this patient. So that first month she'll be getting half of her standard dose. So technically she would be getting 30 milligrams daily. So instead of taking the medication twice a day, she would just take a 30 milligram tablet once a day again during that first month. So in order to reach that potential curative effect of isotretinoin, we need to get a cumulative dose of 120 to 150 milligrams per kilogram total. Math. So typically to get the full course of Accutane to reach that cumulative dose, it takes anywhere from about 5 to 6 months on average depending on the patient's weight and the dose they are given. So stopping the medication too early may lead to that cystic acne coming back. Also, we do start to see rapid progress as far as acne treatment about 2 to 3 months into the course of isotretinoin. Now let's go back to the issue of pregnancy prevention. All patients who go on isotretinoin are required to register in a program called the Ipledge REMS program. Ipledge is an online, mandatory risk management system regulated by the US FDA with the goal of preventing fetal exposure to isotretinoin. This is a system by which the prescriber, the patient, the pharmacy are all linked and given particular obligations in order to ensure that the patient taking the medication does not get pregnant. It's basically a system of checks and balances. Ipledge categorizes patients as either those who can get pregnant or those who cannot get pregnant. Those who can become pregnant are biological females with a uterus and with at least one functioning ovary, and those who cannot become pregnant are either biological males or biological females who have undergone a hysterectomy and or bilateral oophorectomy, or postmenopausal females. All definitions and categories according to Ipledge will be listed here. For ease of explanation, I will be using an example with a biological female and then a biological male when describing the different requirements as far as registering, monitoring, and discontinuation of isotretinoin. For biological female patients, it is required that they commit to 2 Ipledge-approved birth control methods 30 days prior to initiating isotretinoin, while on isotretinoin, and at least 30 days after discontinuation of isotretinoin. The patient will have a primary form and a secondary form. So for example, the primary birth control method may be combination birth control pills, and a secondary method may be male latex condoms that they use with their partner. Here are some Ipledge-approved primary forms of contraception. Examples of secondary forms of birth control include cervical caps, cervical diaphragms with spermicide, or vaginal sponges. Of note, a patient may technically claim abstinence as long as they are committed to having no sexual contact with a partner that may result in pregnancy. However, this is only really recommended as an acceptable form of birth control if abstinence is part of a lifestyle choice, such as a religious practice, and not just a social circumstance. Unacceptable forms of contraception include progesterone-only mini pills, female condoms, natural family planning, breastfeeding, withdrawal, or cervical shields. For those who can become pregnant, the process of registration, confirmation, and discontinuation in regards to Ipledge can get very confusing, so I'm going to try my best to make it as easy as possible. So let's say we have that same female patient from earlier here in office ready to initiate isotretinoin today. She is currently on combination birth control pills and is using male latex condoms with her partner. Once all contraception counseling is discussed in the room, the patient is then going to leave us a urine sample in office in order to perform perform a pregnancy test. She will then register an Ipledge as a patient who can become pregnant under the rendering healthcare provider's account. We basically do this by providing the patient an iPad in office. While in Ipledge, as she's registering, she's going to add her basic contact information, and then we also are going to place the results of that pregnancy test in that section as well. So once all consent forms within Ipledge are marked as reviewed, the patient is then going to sign either electronically or physically, as these forms can be printed out in the office. If the patient were to be a minor, the legal guardian is going to sign on their behalf. Once that is completed, the healthcare provider is also going to sign these documents to complete the registration process. The patient is also going to get her own unique Ipledge ID number, which can be used by all parties involved in order to look up the patient in Ipledge. So that completes the registration process for the patient, and also during that same visit, the healthcare provider is going to provide a lab slip to the patient in order for her to get her labs drawn prior to going on isotretinoin. So what now? This is very important. For all patients who can become pregnant, there's a 30-day waiting period. And what that means, once that initial registration has been completed, the patient must wait at least 30 days before performing a second pregnancy test in order to complete the whole process. So after that initial pregnancy test and registration, the patient comes back in 30 days to repeat a pregnancy test. And once we see that that is negative, we can go ahead and start the medication, assuming the lab values are in range. That brings us to confirmation. When the patient comes back to do that second pregnancy test and everything is negative and good to go, we can go ahead and confirm the patient Ipledge to initiate therapy. Please note, though, that the second pregnancy test should be performed within the first 5 days of the menstrual cycle. So once confirmed in Ipledge, this opens up the patient's 7-day window. What does that mean? So the 7-day window is a time frame in which the patient must go into her Ipledge account and answer comprehension questions. These are going to be the same questions that she has to answer every single month. If this is not done, the pharmacy cannot dispense the medication. Part of those questions include those primary and secondary forms of contraception, and these have to match those that are input by the provider. So when, again, I confirm the patient, I'm entering in those primary and secondary forms of birth control, and the patient's also doing that on their comprehension questions. If there is a mismatch, that can cause problems as far as the patient getting the medication. So whenever there is a mismatch, the provider will be alerted of that, but technically the patient has to call Ipledge in order to get that fixed, and that correction has to be established with the provider. So once the pharmacy sees that the provider confirmed the patient and the patient completed their comprehension questions, she can then receive her medication, finally. And when that medication is dispensed, that's also going to be documented in Ipledge from the pharmacy, so healthcare providers can see that on their end as well. Going back for a second again, what if that patient does not complete those comprehension questions within 7 days? Well, what's going to happen is at that point, the patient's going to have to wait about 19 days after their last pregnancy test in order to perform another pregnancy test to be confirmed, and then a new 7-day window opens. So we try everything to avoid that possibility, so I always recommend that the patient try to complete those questions in office so that all is smooth sailing. So when 30 days have passed from the last confirmation, the patient returns to the clinic to get their next month's prescription and to be confirmed again in Ipledge. Legally, a healthcare provider can only prescribe 30 days worth of isotretinoin. So let's go back to our example patient, and let's say that she's coming back after completing her first month of isotretinoin. At this visit, we basically go over the side effects, review those initial labs with the patient, and answer any basic questions that the patient may have. Also, once the patient has completed at least 1 month of isotretinoin, those labs have to be repeated again. That's because we compare the labs at baseline and then at least 1 month into the medication just to monitor for any changes that the medication may be causing. During this visit, again, the patient's going to do another pregnancy test. That's going to be true of every single month that she comes in for isotretinoin. Once we see that that pregnancy test is again negative, we go ahead and confirm her once again in Ipledge using that same system. So once the patient has successfully reached her cumulative dose and we see good results and she's in that potentially curative range, we can go ahead and discontinue Accutane. I will say though that usually the month prior, when we know it's going to be the patient's last month, we do select that in Ipledge as it being the patient's last month of therapy. So let's say that same patient comes back after just finishing her final month of isotretinoin. Again, we repeat another pregnancy test, and this will be called the initial post-therapy pregnancy test that's going to be input into Ipledge. Now, it is important that the patient continue her birth control methods, as again, that medication stays in the system for at least 1 month after discontinuation. So again, the patient will have to come back 30 days after completing the medication in order to perform another pregnancy test so that we can enter that final test into Ipledge. If that patient does not return to the clinic, technically she has lost to follow-up, and that has to be documented as well. Now, for biological males or for those who cannot become pregnant, the process is much simpler. The patient will register an Ipledge just as our female patient, but no pregnancy test is going to be performed. The biggest difference between those who can become pregnant and those who cannot become pregnant when it comes to registering for Ipledge is that 30-day waiting period. Biological males or those who cannot become pregnant do not have a 30-day waiting period. So it's a little bit easier to start the medication. So let's say we have a biological male patient in our clinic today. So same sort of process, he's going to register in Ipledge and he's going to sign all the consent forms and get his own unique Ipledge ID. A lab slip, the same labs are going to be ordered for that patient, and the difference here is that once those labs are received and reviewed by the provider can go ahead and send the medication out to the pharmacy and notify the patient. So much easier. So that patient's next visit is going to be once the patient has completed that first month of Accutane, so about a month later. And he too has to be seen every single month in order to receive his next prescription of isotretinoin. For biological males and those who cannot become pregnant, they're also going to be confirmed in Ipledge every single month, but there's, of course, going to be no pregnancy test added. It's just basically confirming that the patient is qualified and meets all the expectations as far as taking the medication. Also, for biological males and those who cannot become pregnant, once they are confirmed, they actually have a 30-day window. They do not have a 7-day window as patients that can become pregnant, like a biological female. So they have a little bit more time to receive the medication. Again, after that first month of completing isotretinoin, this patient too is going to have to repeat the labs, and that's just something we may or may not have to monitor throughout the course depending on the lab results. Going back to our example, once our male patient is done with his course of Accutane, he's just done. Nothing special that he has to do or come back for, but it is important to note that this patient cannot, again, donate blood at least 1 month after discontinuing the medication. So there you have it, all of the essential information in regards to isotretinoin and Ipledge. If you'd like to stick around for a couple minutes, I will be answering some frequently asked questions in regards to the medication. Otherwise, I invite you to like, comment, and subscribe to my channel for all things dermatology content. I'm Sheila G, the PAC, and I'll see you next time. Now let's get into some frequently asked questions. Number 1, does Accutane stunt growth in adolescents? So there is some evidence to suggest that young adolescent patients whose bone growth plates have not yet fully closed may be susceptible to premature epiphyseal closure while on isotretinoin. However, that is directly correlated with the patient's age and the dosage that they're given of isotretinoin. But we don't have enough clear evidence to truly correlate growth impairment with any particular dose or duration of treatment. Number 2, what if I started isotretinoin with one provider, but then need to transfer care to another provider? In this case, the patient will have to call the Ipledge customer service line in order to transfer care to the desired provider. This request will then appear under the desired provider's portal in Ipledge, and he or she will have to accept that patient. I will say, though, this is highly discouraged as it can cause a lot of confusion and possible delays in treatment. Number 3, what happens if a patient does become pregnant while on isotretinoin? That's our worst nightmare. But in this case, the medication must be immediately discontinued, and the pregnancy positivity will have to be documented by the provider in Ipledge. The patient is then going to be referred to an OBGYN that specializes in fetal toxicity. So what happens if my lab values are increased while on isotretinoin? So triglyceride, cholesterol, and liver enzyme elevations are usually mild and transient while on isotretinoin. But if those levels start to exceed 3 times the upper limit of normal, the medication must be stopped. For mild elevations, these are normally monitored throughout the course of isotretinoin, depending on the provider preference and their particular guidelines. Again, thank you guys so much for watching, and I'll see you next time.